Welcome to this lesson on principles of clinical reasoning in prime care nursing practice. By the end of this section, you will be able to list the key steps used in clinical reasoning from first contact to decision-making. Distinguish between signs and symptoms using patient examples. And identify red flags that require urgent review or escalation. Let's begin with the steps in clinical reasoning. Clinical reasoning is the structured process clinicians use to move from data to meaning to safe action. It is a continuous cycle and not a one-time event. Let's look at the key steps from first contact to decision. This steps includes recognizing and collecting relevant data from history, vitals, exam, labs, patient-reported concerns. Next, you interpret abnormal findings by asking, what do these changes mean physiologically? You then identify patterns. Do findings cluster into a deterioration pattern or disease process? After that, you prioritize risks by determining which problem threatens life or function first. This leads to decision-making and action. Whether to intervene, monitor, escalate based on risk and reversibility. Finally, you reassess continuously by asking, is the patient improving, worsening, or showing new risks? A key question to guide your thinking is, what is happening now, and what is most likely to happen next if I do nothing? Now, let's look at the difference between signs and symptoms. In clinical reasoning, it is essential to separate what the patient feels from what you can objectively measure. Symptoms are subjective. They are what the patient reports. These include pain, nausea, dizziness, breathlessness, and fatigue. On the other hand, signs are objective. They are what the clinician observes or measures. Examples include an increased respiratory rate, low blood pressure, fever, edema, or altered level of consciousness. A patient may not report feeling very ill, but a sign like R28 is a physiologic warning that must be interpreted. Next, we examine red flags. Red flags are clinical findings that indicate a high risk of deterioration and the need for urgent review or escalation. These include sudden changes in mental status, such as confusion or reduced alertness. They also include abnormal vital signs, especially when there are rapid changes or concerning trends. They include signs of compensation, such as increased heart rate or rapid breathing, that may hide severity. Furthermore, they are signs suggesting decompensation such as worsening hypotension, increasing work of breathing, collapse in function. It is important to note that normal vitals can be falsely reassuring if the patient is compensating or if deterioration is early. Red flags include patterns and trends, not just single readings. That is it for now. Let's summarize the lesson. This lesson introduced clinical reasoning as a structured and continuous process that guides safe decision-making. We also clarified the difference between symptoms, what the patient reports, and signs, what the clinician observes. Finally, we highlighted red flags as critical indicators of potential deterioration, emphasizing the importance of early recognition and timely escalation. We shall continue the lesson in our next video. Thanks for watching. See you in the next lesson.